Good afternoon and welcome. This is still Women Radio 91.7, Nigeria's first and only radio station for women and their families. I'm glad to welcome you to today's edition of Women's Reproductive Health and Rights, a program that is specially brought to you by Vision Spring Initiative. And yes, it is very important that we discuss about women's reproductive health and rights. And today we'll be joining us our guest Elizabeth Obange Enu Akan. Our conversation today will delve into critical issues surrounding safe abortion, the suspension of the Lagos State guidelines on safe termination of pregnancies, the Violence Against Persons Prohibition Act and its provisions for the health and safety of women, the Maputo Protocol and the government's responsibility in implementing these laws and policies. I am Miracle Philip, and like I said, today we'll be joined by Elizabeth Obange Enu Akan, who is a passionate advocate and activist for sexual and reproductive health rights and safe abortion. She has been on the forefront of this advocacy, championing the cause for safe, legal, and accessible reproductive health services. We will discuss the limited access to comprehensive sexual and reproductive health rights and safe termination of pregnancy on individuals, families, and communities. We'll also address the specific challenges faced by young people, the role of community support, and the importance of tackling stigma and misinformation. This program is brought to you by Vision Spring Initiative. Well, join me as I welcome Elizabeth Obange Enu Akan. Good afternoon to you, Elizabeth. Glad to have you.
Hello, good afternoon. Very nice to be on here. Can you hear me?
Yes, we can hear you loud and clear.
Thank you very much for having me.
And thank you so much for joining in. As we kickstart this discussion, I would like to know what inspired you to become a sexual and reproductive health rights and safe abortion advocate and activist, and what has been the wins and challenges in your advocacy efforts so far?
All right. So for me, it all began from university as I studied public health, and so we talked about sexual and reproductive health rights, and that was the first time I got to know that there was anything called sexual and reproductive health rights. That was also the first time I got to know that abortions were not a dangerous procedure, and they're just something that has been made unsafe because of the laws that don't allow women to have the procedure safely in the hospital. So that was where my advocacy started from, because all this while I had believed, like so many people believe, that abortion is a lethal killing procedure. And so having to study about sexual and reproductive health and rights in school was something that just opened me up to the knowledge that, what I have been, taught all my life was just something different and, wrong, misinformation. There's a lot of misinformation. And so I started to read more about it. And unsafe abortions are an issue of public health concern. So it's a very big issue. My wins so far have really been spreading the knowledge. Sometimes people come to me to say, before you posted about this, before you said something about this, I didn't know that, something like that was happening. And, just being able to spread knowledge, because I really focus on spreading knowledge, because I believe that when people are properly informed, they'll be able to make the right decisions, and they'll be able to weigh, everything that needs to be weighed properly. So I think that's my win. And then the challenge that I have really is censorship. There is a lot of censorship on social media. In Nigeria, there's a lot of that particular health service in that by law, they have a population of women can access with those services safely and in the hospitals as they should. So that's really a challenge, censorship. I've had Instagram remove my content without even telling me. So my content removed, but I was still seeing it. However, other people could not see the content. So that's another level of censorship where you don't even know that you're being censored. So those are the challenges that I faced so far.
Thank you so much for, just giving us that brief right there, Elizabeth. And I really must applaud your bravery in coming up with this area that you choose to focus on and shine your light. Now, Elizabeth, from your experience, what are some of the most significant impacts of lack of access to comprehensive sexual and reproductive health rights and safe termination of pregnancy on individuals, families, and societies? And how does this really contribute to broader social inequalities?
All right. So I'll just begin from the individual. The effect of lack of access to sexual and reproductive health services and also safe abortion on the individual. First of all, you have your physical health, where people have to go to work, people have to visit places that are not do not have the facilities and they are untrained to do these things. People have to see people who do herbs to have to access safe abortion, and so it's just the unsafeness of it. So the physical health, the physiological health of women is compromised. That's the first thing on the individual. Then you have the mental health. It can cause a lot of stress. It can cause a lot of depression, where people are seeking, they are desperately seeking services, and they are unable to find them because by law, they're not allowed to seek these services, and they are, just unable to find where to get the services. It can cause a lot of depression, especially in younger individuals, because we also have an issue of age discrimination in the country where there is discrimination by age. So the younger you are, the more likely people are to judge you for seeking sexual and reproductive health services. And then also it limits the choices that people can make. Let me give you an example. When I used to work in the sexual and gender-based violence sector as a first responder, I still have those cases, but as a first responder, there was a girl who came to us and she said that she had been raped. So she had been raped and she got pregnant. And at the time that she was reaching us, she was 5 months pregnant. You see, this girl was from a very, very poor and disadvantaged household and setting. She didn't have access to the internet. She did not have access to many things. And so when she got raped, the response to getting raped was silence and just maybe if I keep quiet about this thing, it will go away. It did not go away. She got pregnant, and after the time that she was reaching us, her father was telling us that, he doesn't want any trouble, and if we can find a way to get the rapist to pay for her birth and, some of the expenses of pregnancy, that he would be fine. So you see that if this child was unaware of her sexual and reproductive health, because if she was taught in school, she would have known that, there are rape centers I can visit after getting raped, even if I don't want to tell my parents. She would have known that perhaps, if I go to these centers, there's something called emergency contraceptive for when you have been raped. She did not know all of these things. So you see that it affected this child's life because she was only 14. It affected her life, and you see a pattern to these things. Younger girls in disadvantaged settings, in poorer settings, are more likely to suffer the consequences of limiting access to sexual and reproductive health. And I'm very sure that if this girl had the knowledge of these things, she would have made different choices, and she would not have had the outcome that she was having at the time that she came to us. And the next thing is the family setting. So on the family setting, we have financial strain. There was a case on Twitter that came up some time ago. A doctor came online to talk about how a girl came with her family and she was having hemorrhage from unsafe abortion, right? And the family had to come to the hospital with her. And mind you, they did not come early. So there's also stigma and what stigma causes. They did not come early. They tried to delay it as much as possible. Even the girl, when she came, was saying, I don't want to put my family to shame. But that should not be the concern of somebody who is suffering the effects of blocking healthcare from women. And she died because she came to the hospital late. Now that family has to cover the hospital expenses and also cover the expenses for burying their child. just because the government or the laws are limiting people, stopping people from accessing the services. Then we have the emotional toll, right, on the family. The family of this particular girl that I just told the story about, how would they feel? What amount of emotions would they be going through just because they were denied access to proper healthcare services? Because had this procedure been done in the hospital and she started to hemorrhage, it would have been taken care of before it even became a problem. That's the reason there's a hospital. That's the reason there is healthcare facilities there. It's to take care of people regardless of who they are. Healthcare is for all. And then we have unstable living conditions. Like the girl I mentioned earlier, the father says he has 8 children and I think about 2 wives. And they live in a really small house. And so he said that the girl cannot continue to stay with them with the child because it's too much pressure on his family that is already struggling. So we also have unstable living conditions. Then on families as a whole, we have increased poverty. This child who's, father struggling to send her to school has now gotten pregnant by rape, and she did not have enough access to sexual and reproductive health knowledge to know that this is what I can do after getting raped. And now the family has to bear the burden. The father was trying to train her to go to school, to get better education and have better chances in life. And now she's going to drop out. So you see that is significantly going to affect how much she's able to earn in the future. So you see that it has increased the level of poverty. And we also have reduced educational attainment. Like I just said, she has to stop school. She has to give birth. She has to wean the child. All of this process takes about 3 years. And for somebody who is poor, right, it's so there's a lot of things and strain on the healthcare system. Our healthcare system in Nigeria is already overly burdened. We have a lot of healthcare personnel leaving the country for, good reasons. But the point is that we are suffering. We do not have enough people to cater to us at the end of the day. And so that's another consequence of limiting access to sexual and reproductive health and safe abortion. Now, how does this contribute to social inequality? These things that I mentioned affect the poor people disproportionately, right?
Yes.
If a rich person finds herself pregnant, or the rich person's child, it's very easy for them to afford healthcare, regardless of how much it might cost. And not just healthcare, quality healthcare. In this country, outside of this country, we have even heard stories of people who travel to the UK, for example, to
Hi, Elizabeth. May I know if you're still there with us, Elizabeth?
supposed to, move around. So you see that these things affect low-income families more. And then it also increases the level of poverty because if people do not have access to sexual and reproductive health rights, which includes contraception, family planning, how are they supposed to be able to plan families? How are they supposed to be able to prevent pregnancies? How are they supposed to be able to safely end pregnancies? And so that they can, take care of the children that they have at the time, to be able to take care of the people that they have in a way that does not affect earning power or reduce their ability. Because I have worked in community settings and I have seen, a woman with 3 children. Madam, why are your children not going to school? She says, I only have money to put one. Who will I put and who will I leave out? So let all of them stay back. Right? So life is not really straightforward. It's very complicated. But if people have access to their sexual and reproductive health rights, and they know that this is something I am entitled to as a human right, they would be able to better plan their families and better plan, how many children they want to have and, how to take care of their children, even child spacing better. So that's just the ways that it affects people and also the ways that it increases social inequality. Thank you.
Thank you very much, Elizabeth. There was so much to glean from everything that you shared with us right now. And it makes me even look at even more, specifically for young people and as a young person yourself. How Do you think that unintended pregnancies have really impacted the health and well-being of young people? And are we really doing enough to address this as a society?
I'm sorry, please can you repeat that?
Okay, so
I didn't get that.
specifically for young people, and as a young person yourself, how have unintended pregnancies impacted the health and the well-being of young people? And do you think that we're doing enough to address this in our society?
All right. Thank you. No, we're not doing.
Elizabeth, may I know if you're still there with us? All right. What was
47, 100,000.
okay?
And for adolescent girls, the what? It is 5,415 per 100,000 live births, and that is way too much. Because in comparison, the country with the lowest incidence of maternal death has 3 maternal deaths per 100,000. So why are we having 1,047? And then when you go higher, when you go lower to adolescent girls, the number is higher. So this just shows you that there's a lot of health risk to forcing children to give birth. There's a lot of health risk. And even when you see things like DVS, that's just not the only thing. These children could die. They very well could die. So there is that. And then also, we as a society we used to talk about pregnancy like it's a walk in the park. Pregnancy is not a walk in the park. A lot of people have developed lifelong illnesses just because they got pregnant willingly, right? And carried the pregnancy to term.
Okay.
So, around that period, become crippled. And there's just a lot of things from past. So there are a lot of health risks to unintended pregnancies, especially when it is from people who officers. They would not go for antenatal early, they go for antenatal later.
Okay.
There's a lot of, little things that are happening. And so even when they seek abortion, they what they have for the most, or what they can afford for the most part, is unsafe abortion. And that also puts their health at risk. You have people that have had their intestines hanging out of their vaginas because they had unsafe abortion. You've had, so there's a lot of things that could happen when you release the health of people, human beings. What? People who have no medical training, people who have not been properly certified, and just say, we are not going to cater to you. My church says having abortions does not stop abortions. It just increases unsafe abortions. That's exactly what is happening. And then for young people, education disruption. Oh, you're pregnant now, you can come to school. And that happened when I was in secondary school. There was a girl who got pregnant, and she went to speak to the principal. Removed from school. I do not know. I do not know. Nothing happened to the person who got pregnant, right? But the girl herself. And so when you look at her leaving school, carrying the pregnancy to term, giving birth, breeding the child, that usually takes about 3 years. So this child has lost 3 years, if she's lucky. Some of them are never able to go back to school. And then we have the psychological stress. If people tell you, teenage mothers,
All right, Elizabeth, may I know if you're still there with us?
girl who got pregnant.
Okay.
Yes. Can you hear me?
Yes, we can hear you now.
Hello?
Yes, we can hear you loud and clear.
All right, please, where did you stop?
Oh, yeah, you were talking about the teenage girl who got pregnant.
Yes. So there was a girl. When you talk about people like so there was a girl who got pregnant.
Elizabeth, may I know if you're still there with us?
I can't take the girl, sis.
Okay.
So the girl got, they discovered that the girl was pregnant after a while. And they sent her, it was around the COVID period, to live with her auntie. And then places where the auntie ran in, like a beer parlor. And then places were shut down during COVID. And then the auntie had to leave the village, but couldn't take her because they were hiding her, due to shame or something that she had. It was not her fault, clearly. They could see it with their eyes. And she tried to kill herself 4 times.
Oh, my.
She tried to kill herself 4 times and she was found by an organization. But you just see, because this girl was left without a way to feed and a way to fend for herself, abandoned by her parents because she got pregnant from rape that they saw. And, they know very well that this girl was not to blame. But anyway, she took it. And so you see the psychological stress that girl had to go through to kill herself.
All right. Okay, Elizabeth, I believe you're still there with us.
Yes, I am. Can you hear me?
Yes, we can. Go ahead.
Okay. I said an unplanned pregnancy, for example, can derail a girl's life, her career, her educational path. Not just because, for example, people, when you talk about, they'll be like, oh, you leave the child with your mother. Not everybody has a mother, one. Not everybody has a mother who is physically able to cater for children. Some people have old parents who are literally trying to walk. They have arthritis, they have osteoarthritis. How are they supposed to take care of a child, of their child who they are still, by the way, struggling to raise? So a lot of people do not put these things into cognizance, but an unplanned pregnancy can significantly impact a young girl's life. And even the stigma in Nigeria about, single mother, she must have been wayward, yada, yada, yada. So it just does a lot of things. And so you see that as a whole, lack of access to sexual and reproductive health services, or even, for example, comprehensive sex education, can leave a young girl and a young child feeling very much unknowledgeable, and it can lead to a lot of things. Lack of knowledge. The other girl, she was raped. She did not have the knowledge that you can go to a rape center. She got pregnant. She did not even know what pregnancy looks like or feels like or maybe she was hiding it until she was 5 months gone. She probably did not know that there was the option of safe abortion if you are raped. She had none of that. And then if a child is uninformed, right? A lot of people say, I don't want to spoil a child. It's not such thing as spoiling. There is naivety, there is innocence, right? It is bad for you to lead a child to be naive, right? Your child can be knowledgeable and innocent, but to be naive is to be uninformed, lacking knowledge, and you can be molded by anybody to do to be whatever just because you do not have access to accurate information to make the right decisions for yourself. And then we have social stigma. In Nigeria, sex has so much stigma. You shouldn't talk about it. If you're a good, proper person, if you're a pure, holy person, you shouldn't say anything alluding to that. So you see that people are unable to communicate with their parents, their relatives, and so they are often communicating to their peers. What their peers, for the most part, for adolescent girls, for example, their peers don't know anything at the end of the day. They know almost as much as they know. So you see that these girls are just left in a circle of lack of information. And, that is something that is very concerning. And then we go to contraception. So the societal norms and values and also restrict access.
All right. If you've just tuned in, this is still Women Radio 91.7, and we have with us Elizabeth Enu Akan. Yes, we can hear you loud and clear, Elizabeth. And yes, we've been...
Yes, I can.
Okay, so this has been a program put together by Vision Spring Initiative. We've been discussing women's reproductive health and rights right here on Women Radio 91.7 with Elizabeth Obage Enu Akan, who is a sexual and reproductive health and rights advocate. Now, just as we wrap up, Elizabeth, I'd like for you to show us really what are the goals and priorities for you as a sexual and reproductive health rights activist, actually, and what strategies do you believe are necessary to ensure that reproductive rights and access to safe termination of pregnancy services for individuals who need it can be made possible?
Okay. So my goal at the end of the day is for accurate information to be spread to the public as much as possible, to be diffused in such a way that women, even women who do not have access to safe abortion, for example, or women who don't even have access to phones, like you and I, are able to know what their options are. Oh, I can get contraceptives. Or if I'm raped, there are rape centers. I have to locate one. Or if I need to save my children, or if I'm not ready to be pregnant, I can have contraceptives. That is what I really want women to know. I want to be, my goal is for knowledge. So the strategies for mobilization that I would talk about would be grassroots organizing and also community mobilizing, where we talk about those things. So when we talk about, when we say mobilize or speak to people, sometimes people think that we mean the entire public, the general public. You can talk about it in a taxi when it comes up. You can tell it in your church, your little girls group, your little women's group. You can talk about it anywhere and everywhere that the topic of reproductive health and rights comes up. So that is how you mobilize with grassroots. And you can also talk about it on social media. You can repost things that talk about it on your own social media to share to the audience, the people in your audience. So those are the ways, those are the strategies that we can use to make sure that information, accurate information, is disseminated about sexual and reproductive health rights.
All right.
Yeah. Health, reproductive health and rights, not just reproductive health. Yes. So thank you. That's it.
Okay, thank you so much to you, Elizabeth Obage Enu Akan, for sharing those insightful experiences and making them all so invaluable to us as well as an advocate for sexual and reproductive health rights and safe abortions. It was such a pleasure having you today. Thank you.
Thank you. Thank you very much. It was a pleasure to be with you on Women's FM.
Okay, well, this is still Women Radio 91.7. As we conclude, it's clear that the fight for comprehensive reproductive health rights and safe termination services is far from over. We must continue to address stigma, provide accurate information, and mobilize community support to ensure that all women have access to the health services they need. So let's continue to stand together, advocate for change, and work towards a future where every woman's reproductive health and rights are respected and protected. Just to let you know that this program on women's reproductive health and rights was brought to you by Vision Spring Initiative. Thank you so much for being a part of this program. Special thanks to my producer, Owolabi Oreolua, and my executive producer, Tom Okewale Shunaya. Do have a wonderful day, and we look forward to bringing you more impactful discussions. I am Miracle Phillip. Good afternoon.